again, everyone, and welcome back to the Arthritis Broadcast Network's hashtag CR Arthritis. I don't even remember what is the number of our interview, but we had quite a few. And so I'm Isabelle Troïtzky with Arthritis Consumer Experts and the Global RA Network. And I'm thrilled to be today joined by Dr. Lihi Eder, who's a rheumatologist and clinician scientist at the Women's College Research Institute and an associate professor of medicine at the University of Toronto. Welcome.
Hi.
Thank you for being with us today. So I'd like to just ask you a simple question first. Who are you? What's your role? What's your involvement in rheumatology?
Okay, so I'm a rheumatologist, as you mentioned. I am originally from Israel. I moved to Canada 15 years ago to pursue additional training in rheumatology and psoriatic arthritis in particular, and I fell in love with Canada and Toronto in particular and stayed. And I work now, as you mentioned, in the University of Toronto. My main area of research and clinical interest is psoriatic arthritis. I'm particularly interested in understanding the early phases of the disease. So who are the patients that actually develop the disease, trying to find tools to identify these patients early and diagnose them early and give them early treatments, maybe even delaying the onset of the disease. I use a lot of ultrasound, and I'm really find it very helpful too in managing this condition. And the other area of interest is cardio-rheumatology, which is a new area, relatively speaking, where we're trying to better manage the risk of developing heart diseases in patients with rheumatic diseases in general. We know that this risk is high, and patients tend to be undertreated and underdiagnosed. So we're trying to find ways to provide better care for patients.
Great, and I noticed as well that one of your focus of research is also the impact of gender on the outcomes of the disease or PSA.
Yeah.
So where are you at with that?
So yeah, that's a more recent interest, and I actually was awarded the Canada Research Chair to further investigate this topic. It is becoming clear that sex and gender aspects are really important in how patients experience the disease and the chances of their responding to treatment. So we're trying to find or understand what are the mechanisms that are driving these differences between men and women. And there might be some biological factors, but there are also factors that are more sociocultural aspects where, the healthcare system might treat men and women differently. So this is just one example of, gender aspect of these things. So it's really a fascinating topic. We're presenting a few studies on this in the CRA meeting this year.
Okay. Well, one of the big focuses as well of ACE, Arthritis Consumer Experts, is inequalities, healthcare inequalities. So gender is one of those subtopics. So very interesting. So you said you'll present a poster about this tomorrow. I know this morning you've also participated in a workshop, and then we actually interviewed another participant, nutritionist and diététiste en français, Kim Ari, on the subject. So that's the subject of weighing the facts, talking with patients about exercise weight matters, and what to do about it. So are there any interesting facts or insights that patients and our viewers are maybe interested in knowing?
So I think many people don't know, but overweight or weight in general plays an important role in the way people with arthritis experience their disease and their chances of responding to treatment. So generally speaking, people who have higher weight are experiencing more pain and more disability. We also know that the risk of developing heart diseases is higher, and so that's another factor that is contributing. And then it can also affect the way the rheumatologist is able to assess the degree of disease activity. It makes it more complex because it could affect the results of some blood tests. It could affect the ability of us as rheumatologists to accurately quantify how much inflammation there is in the joint. And I guess the other aspect that I think is really important is that many people don't or consider obesity or higher weight as being like a lifestyle issue. So it's not that. And many physicians also, I think about it this way, and that's wrong. That's wrong. And I think us as rheumatologists, we have a responsibility to discuss this issue, the importance of managing weight with patients, and it's really hard to do it alone. So I think people that experience this condition need often help from multidisciplinary care, like dietitians or group programs to help manage lifestyle changes. Also, exercise is another important aspect that is more difficult for people with painful joints to do. So me as a rheumatologist, I provide counsel regarding the importance of doing exercise, but also how to be able to do it in the context of arthritis. So, for example, using pain medication before you plan to do your exercise, or the importance of starting slow and with something that you think you can stick to for a long period of time. It doesn't have to be a very intense exercise. You don't need to be able to run a marathon. Just stick to something that is doable, and you can stick to it to most days in a week. So these kinds of discussions, I think it's really important for the rheumatologists to have with our patients. So,
yeah, exactly. So and so that multidisciplinary, aspect is very important. Being a team around the patient, working with the patient, and so yes, extremely important. So about PSA, anything particular that you'd like to share with patients out there?
So I think in PSA, these are exciting times because we have lots of things happening, lots of treatments that have been approved over the past few years. And so it means that there are more options.
Yes.
But studies that are showing, like real world evidence, are showing that still lots of people people who live with psoriatic arthritis don't meet criteria for remission. So they don't meet these thresholds that we would like them to be. We, as a community, we still need to understand how we can use the resources, the medications that we have in a better way, how we can select the right treatment for the right patient. And I guess this is right now, I see it as the major challenge in the field of psoriatic arthritis.
And so you were talking a bit earlier about, early diagnosis. So what parts does it take, what role does it take, or does it play in the patient journey and the outcomes for them?
I think there is still a significant gap in knowledge, both among people who live with psoriasis, which most people with psoriatic arthritis will first develop the skin disease, then the joint disease. So many people with psoriasis, they are not aware of the risk of future development of arthritis. And also many family physicians and even dermatologists are not thinking about this possibility. So what happens is that people develop joint pain and stiffness, and then they're being maybe sent to do some blood tests, but these blood tests are often normal, and they're being told, okay, just live with it. And when I see them, it sometimes takes a few years until they get to see us, the rheumatologists, and establish a diagnosis. So I think we need to do a better job at educating both patients and non-rheumatologists about this condition and the fact that they need to be seen by a rheumatologist earlier than they do right now.
And so, do you see? Because I know you're originally from Israel. So, do you see gaps, across the world regarding those conditions?
Yeah, I'm a member of GRAPPA, which is a big international network of dermatologists and rheumatologists. So this is an area that is common to many places around the world. GRAPPA has been a really good organization, also including many patients partners that share their experience and journey to the diagnosis, and it seems like there are a lot of common themes around the world. We are now trying to develop, or think about new models of care or pathways to reduce this gap or this duration. The other area I mentioned, the imaging, I think this is a really great tool because it allows us to identify what is happening in the tissue, because sometimes in very early phases people experience pain, but on examination there is not much. So it's even harder for even the rheumatologist to kind of come up with a diagnosis. So using ultrasound is a great way of seeing if there is anything going on in the tissue and making a diagnosis earlier. So this is I am active in trying to promote the use of ultrasound in among our rheumatology community, to train more of the younger rheumatologists to be able to use this tool.
Yeah, great. So it's you're doing that in at the university with students.
So this is something that's been adopted, unfortunately, a little bit slower than I wish it would have been. But many rheumatologists now in Canada are having these training programs as part of their training as rheumatologists. I'm also the vice president of CRUS, which is the Canadian Rheumatology Ultrasound Society, and we run courses, national courses for rheumatologists to be able to get some extra training in being able to do this. So, promoting the use of ultrasound among rheumatologists in Canada, I think, is really, really critical to improve care of patients, not just for diagnosis, but also for monitoring of disease and guiding injections into joints. So it's quite a useful tool to have in the clinic as an extension of the physical examination.
So there are some great avenues, great solutions for to improve the outcomes of the disease for patients. That's right, and you are involved in so much. I'm impressed. Bravo. Anything else you'd like to say before we go to questions, if there are any questions out there?
Well, I just wanted to say to the audience or the listeners that I think, and that's the message I try to convey to people who are, especially with recent diagnoses, is that there are lots of new, like most of the people, because of the advances in care, most people are able to have their symptoms managed and live normal life. And I think it's really important for people who live with arthritis to read and become educated and come to the rheumatologist with questions and discuss concerns and be involved in their care, because I think this is really critical for having a greater success of treatment and also patient satisfaction, and ultimately leads to better outcomes. So,
yeah, definitely. So the involvement of the patient is key. And so, are there any resources that you'd like to recommend for people to investigate before talking to their physician?
I usually refer my patients to the Arthritis Society, Canadian Arthritis Society. They have really good resources. specifically for psoriatic arthritis, the National Psoriasis Foundation, which is an American organization, but still they have really good resources that are specific to psoriatic arthritis, discussing all aspects of their disease, like diet and comorbidities and medications. So I find that the discussion when people are coming prepared is very, very helpful, and I'm always happy to have long discussions with my patients, especially about all aspects of care. I think it's really important.
Yeah, and that's why actually the Arthritis Consumer Experts and the ABN exist as well, to inform and educate patients, and also we also have videos on how to actually have those conversations with your physician, because it's sometimes very intimidating, we wait a long time sometimes to see a rheumatologist, so you have to profit by the time you have there. Any questions from the audience?
As a patient, you mentioned that it will be super helpful for you if we bring in questions, like at which point is too many questions, or like how, because patients will have so many questions, and how do we filter what is the best question to ask you?
Yeah, I personally, I try to answer as many questions as I can within the visit, because I think the conversation is really important. I think it's important to write down the questions and think about them before you go to the physician, and then it depends, I guess, on time and many different aspects, but generally speaking, I think discussing the questions that are really relevant to care. So if the topic of a particular visit is changing treatment, then I think answering questions around this topic will be on top, and then depending on the number of questions, then moving on to other topics. I know that I'm very passionate about the topic, and I can spend a lot of time discussing, but sometimes it's challenging in a very busy clinic to spend a lot of time. But so I guess focusing on the topic of that particular visit would be a preference.
Thank you. So thank you again for passing by our booth, for addressing those questions, and thank you to our viewers to continuing to follow us. So we'll be back at #CRArthritis very soon with other interviews, and this is day 2 of the meeting, and there is a day 3. So keep following us.